And still in the news, the Kano State government has directed the local government council chairmen to strengthen health advisory committees in their respective areas. The State Commissioner of Health, Dr. Abubakar Labaran Yusuf, gave the charge at a 2-day engagement workshop with the council chiefs executives held in Kaduna State. Saturday Magazine correspondent Abdullahi Hassan has the report.
Dr. Abubakar Labaran Yusuf said the health advisory committees will facilitate improvement in primary health delivery at local government level. On human resources for health, the commissioner directed council chairmen to consult their legislators and generate a list of qualified candidates from their respective communities for onward recruitment and deployment of general hospitals in their respective local government areas. He advised that the candidates should be those willing to live in their respective communities, as there is no room for deployment to urban areas.
The rationale is to inform the local government chairman on what is expected of them from the health sector. They are new. There is a lot of friction between the local government chairman and the boards, both the primary healthcare management board and even the ministry. So the meeting we had yesterday and today really put everything on the table, and the local government chairman really understood what is expected of them, and they have pledged to do the needful to lift the standard of healthcare in Kano State.
In his remarks, the Director General of Kano State Primary Healthcare Management Board, Professor Salisu Ahmad Ibrahim, directed heads of PHC departments at local government to comply with Commissioner's directive and work closely with their LGA chairmen in rejigging the committees to ensure improved coordination of PHC delivery. He added that the board is planning to host PHC Summit this year to present the results of assessment conducted at 1,200 PHC facilities across Kano State.
Actually, most of the interventions that comes from the federal government, our local government chairmen are not aware of it. Most of the time, the federal government bring about policy and then will attach some financial benefit to that. And because of lack of communication, most of our local government chairmen, they do not access that fund. Like basic healthcare provision fund, like revitalization fund, HOP project, impact project, they are all federal government interventions that comes with counterpart funding from the state and local governments. If the federal government already assigned certain figure, they are expecting the state and local government to also contribute to make it a basket fund whereby the fund can be utilized across the 44 local government areas for our own primary health care facilities.
In his address, the national team lead of Lifeare program, Dr. Usman Gorzo, said Lifeare is supporting local authorities to stick to their mandate of providing quality healthcare services at PHC level. According to him, Lifeare program provide technical support to Health Advisory Committee, reproductive, maternal, newborn child, adolescent health and nutrition, RMN, CHA+N, Committee, Drug Revolving Fund, DRF, Committee, Ward Development Committee, WC, and Ethical Health Financing Committees at local government level.
So this is to ensure that the three major issues related to healthcare provision at the PSC level, which is coordination and leveraging, healthcare financing, and human resource for health, we ride on these vehicles to ensure they are addressed. And that is why we are here with all the local government chairmen in Kano.
In their separate remarks, the chairperson of Association of Local Governments of Nigeria, ALGON, Kano State Chapter, who doubles as chairperson of Tudun Wada Local Government, Hajia Saadat Sadisu Shehu, and that of Gaya Local Government, Alhaji Mahmoud Tajugaya, pledged to implement all of the resolutions of the meeting.
The Minister of Health, together with the Primary Health Care Management Board, and we have discussed extensively on many issues and the gaps arising in the communication and what have you. Now what we have discussed. We are going back. As we get back, we will go sit in Algon and we'll ensure that all the policies and issues that have been discussed, we'll make sure that it aligns with the policies and the programs of the State Primary Care Management Board.
The two-day engagement, which was chaired by Chairman House Committee on Appropriation, Alhaji Aminu Saad Ungogo, featured presentation from seasoned public health experts, including Professor Isa Sadiq Abubakar of Aminu Kano Teaching Hospital. Some of the solutions reached at the end of the workshop includes biannual meeting between health sector leadership, the legislator, and local government chairman, payment of counterpart funding to support health programs, and establishment of PHC task force committees at the local level to improve oversight and accountability. The two-day engagement with local government chairman was supported by FCDO-funded Lifeyear program. Abdullahi Hassan reporting as compiled by Nasiru Yusuf Ibrahim.